Our next video is an overview of the general care treatment process. To begin with, you're given a file from a clinician. You have time to read the medical notes and the previous history. Then it's time to call the patient in from the waiting room. Remember to call the patient's name clearly if they're hard of hearing, and stand at the door when you bring them in. Then introduce yourself to your patient and conduct a 3-point ID check. Confirm that general care is required, and then you can begin cleaning your hands. And donning an apron. Then it's time to select the right size gloves. You will notice that there are extra smalls, mediums and large in this pack, and there's also smalls available from the supply room. Now it's time to open your instruments. Remember, you don't need to open your instruments if general care is not required. When you open your instrument pack, you open it from the bottom, pull it all the way out, and this becomes your new working surface. You should place your used instruments on the right hand side. To begin patient preparation, you take some chlorhexidine solution, put it on some gauze, and then wipe over the feet. It's a good idea to use gauze to wipe firmly between the toes to clean out any areas of dead skin. Once this is done, the goggles can be worn if you're going to be doing nail care, and general care begins. During treatment, you may need to do some scalpel debridement. So open up your scalpel blades, remembering that ideally you should place the scalpel pack with the gold facing towards the ceiling, and then you can load your blade. Being careful, of course, to not push through the bottom of the pack. Once you've finished doing your scalpel debridement, you can use a Click Smart to remove the scalpel blade. Once all your instruments are used and general care is finished, you can place your instruments back into the container, and you will no longer require the pack. But before you throw away the pack, make sure you note down the instrument pack number in your notes. A lid is then placed on top of the container, and it's time to remove your apron before you exit the room. Once you remove your apron, you can wrap it up within your gloves and you can dispose of this neatly in the bin. Don't forget to clean up the floor before the patient disembarks, and preferably do this also before presenting the patient to the clinician.